Hey friends, today I have such a fun video for you. I cannot wait to share it with you. I know I say this all the time, but this one's gonna be really good, so stick around. In this video, I really wanted to talk to you guys about the power of cohesion. And what I mean by that is your ability to essentially sell yourself to another person, your marketability. Can you go into a future employer and show them that you have the exact right background, experience level, passions, and innate talents, and how those things align well with the job that they are looking to hire, the role they are looking to hire someone into? Because here's the secret, not all NP hiring teams are looking for the same thing. Think about this. The person who's going to work in a primary care clinic is going to possess a totally different skill set than the person who's looking for an acute care role. Very, very different. So these teams are looking for people that have different innate talents. They want someone who is going to be a good fit for this role in this team. And your ability to cohesively show them that you have all the experience level, all the passions, all the innate talents, and how that aligns perfectly with what they need, this is what lands you a very competitive spot. You can get your dream job. They want you big time, so you have leverage, so you can negotiate more money. Y'all, cohesion. Cohesion is incredibly powerful. So in this video, I'm going to introduce you to my client and new friend, Rachel, who is a new grad NP who has been working as an RN in surgical trauma ICUs, emergency room. I think she spent some time in a neuro ICU as well. And she was applying for a very, very competitive role at the Cleveland Clinic. I think it's called a resuscitation house officer. And her job would be to go out, be basically an extension of the ICU. She would go out and be an emergency response team member, help stabilize patients, resuscitate them, intubate line, do everything possible to stabilize them in order to get them back to the ICU. So that takes a very specific type of person who wants to do that. But if you are interested in it, what a cool job. Clearly the Cleveland Clinic desires to promote autonomy with NPs. They have a great desire to train them properly. I think it's like a 6-month onboarding time frame where they get cadaver labs and sim labs, and oh my gosh, I don't know really any onboarding jobs that offer that much support outside of like a residency or a fellowship. So phenomenal opportunity, very, very competitive. So Rachel is obviously nervous. So she did this mock interview with me. She got the job offer within, I want to say, a couple of days. They loved her. She had a lot of leveraging power, and that is because of the power of cohesion and her ability to appropriately and expertly share her messaging on what she can offer to that team. Okay, so this is kind of a longer video, so just bear with me. There will be timestamps in the description below. This is basically the Zoom call that Rachel and I did together. The first 26 minutes are me asking her questions and her response. The last half is me giving her specific feedback to every question and helping her tighten up her delivery of the response to each question and kind of how I would reword it so everything is cohesive. All the big takeaways are basically at the end, I want to say a little over an hour mark. I did cut out the resume review section. I typically do a full resume review, but she already had landed an interview. So I think it's a little bit less relative. And also I wanted to make this a little more consumable for you. So that portion is not in here. But just appreciate the fact that her background aligns perfectly with this particular job, and that is a large part of why I think that she got this. If you need help with your messaging because you have a big job interview coming up, this starts with learning how to interview, so I do highly suggest you go to my website and check out the digital course, which teaches you how to interview. And if you want to hone that even further, book a mock interview where we run through basically what I'm going to show you next. I'm going to create a custom list of questions for you and help you to refine your messaging so you too can land your dream job.
All right, so tell me about yourself, Rachel.
Okay, sure. Well, I just want to first thank you for this interview. I appreciate this opportunity. I'm really excited about this position, so I appreciate your time today. So my name's Rachel. I am 36 years old. I grew up in Cleveland, in the West Park area, and I currently live in Medina, Ohio, with my daughter. I am a single mom. I have a 3-year-old daughter, and she's a huge motivation for me to want to continue to advance my career and challenge myself. And I want to set a good example for her being a single parent. I love nursing. I became a nurse in 2016. I got my RN BSN at the same time. So it's been just about 7 years now. Um, it was a career change. I have another degree in digital media arts. So in my mid 20s, I just realized I wasn't invested in that career path and I wanted something that was just more meaningful, where I could work with people more closely and help people on just a deeper level. So I'm very happy with my nursing career. I'm really proud to be a nurse, and I always try and encourage other people that are not sure what career path to choose, that nursing is a really great option. So 2016, I got my first nursing job at the clinic, actually, at the Cleveland Clinic. Main campus, I was on G91, which was a pulmonary step down unit. I worked there for just about a year and a half. For me, that was a good place to start off my career on a step down unit, just to get comfortable with the role of being a nurse and, get a little bit of confidence. And then I knew that essentially I wanted to be in the emergency department. So after a year and a half, I transferred to our county hospital in Cleveland, which was, I believe, the only level 1 trauma at that time. So I transferred to Metro Health main campus emergency department, and I stayed there for just over 4 years. That time was incredible. I can't speak on that experience enough. There's just endless amounts of learning opportunities that you're going to get at Metro in the emergency department. During my time there, I had started back at school, and last year I had this realization that I didn't have ICU experience, and that probably would be a valuable experience to get as an RN before I graduated, to become an NP. So I did transfer last year to our trauma ICU. That's where I am today. And I am just a couple months out from graduation. I'm preparing for boards and still working in the trauma ICU at this time.
Very cool. Okay. Okay. So tell me a little about why you decided to go back to school.
Excuse me.
You're fine. Take your time.
I think when I first became an RN, I knew that at some point I would go back to school to become an NP. I think if I would not have had my daughter, I might have chosen to do that a little bit later on. My desire to want to pursue that role specifically is, I do welcome like the new challenge. I am excited to have this type of responsibility and to, focus more a little bit on like the medicine aspect. I do like how this particular role does encompass like nursing and medicine. And I think, having my daughter, I just realized if there's any time to go back to school, like I may as well do it while she's young enough to hopefully not remember how absent I've been in the last couple of years. Yeah. So I think timing just worked out, and that's essentially why I decided to enroll at that time.
Cool. Okay. So I see that you spent some time with Metro Life Flight. Can you tell me about that?
Yes. So I am currently completing that clinical now. My preceptor is Paula McCann. She's been with Metro for 15 years now. She has some like neurosurgery background. Metro is really known for their Life Flight program. And what really is appealing to me about that particular role is, and it kind of reminds me of this role that I'm applying for, is you're working, the providers on Life Flight are working very autonomously, they're oftentimes out in the field on a scene, and they are their only resource. So they are just, exceptional providers who, have plenty of experience, like intubating patients, putting in chest tubes, very amazing critical thinking skills, just, high acuity patients. And, so I do have a little bit of interest in flight medicine. That may be something that I decide to pursue in the future.
Okay. Yeah, that seems like a fun rotation. Have you been able to do
Yes.
like many procedures with them?
Not so much, no. Unfortunately, during my clinical time as a whole, I have not. I've gotten to do some ABGs. That's about as much, but I already have experience collecting ABGs in the emergency department. It's mostly been a lot of, observing those procedures. And in my role as an RN, I have observed a lot of procedures and assisted in a lot of procedures, but I have not had the opportunity to, I'm sure I can learn those things, but I haven't had the opportunity to do those yet.
Sure. Yeah, that happens in a lot of rotations. That's okay. All right. So it also looks like you've done pretty much all of your school rotations have been with Metro. Is that right?
Yes.
Okay.
Yes,
Was there a reason for that, or do you feel that that's going to impact your training at all?
So the reason being, I have been an employee at Metro for so long. Most of my connections are at Metro. I had attempted to complete a clinical at the Cleveland Clinic, but I had sent some emails out. I didn't get any responses, so I did apply, and then I got word that they didn't have a preceptor for me. I would have certainly liked to kind of expand my clinical rotations out at other hospital systems. Unfortunately, that didn't quite work out. But I do think I got some great experience with the clinical rotations that I did do at Metro. So hopefully that will benefit me still.
Yeah, you've had definitely some very interesting and unique experiences in your rotations for sure. What would you consider to be your greatest weakness?
My biggest weakness, at times I can have a little bit of like imposter syndrome. Like, do I deserve to be here? Am I on the same level as everybody else? I can be kind of, I guess, my own worst critic. And I think that just stems from, a desire to really want to do well. I want to succeed. I don't want to fail. And I think I just need to remind myself that, I've put in the work, I deserve to be here. And, there may be a lot of things that I haven't seen yet or haven't experienced, but, I can learn those things. And, I just need to remind myself to have a little bit more confidence at times.
Yeah. Offer a little more grace to yourself. I think we all struggle with that a little bit.
Yes.
Okay. Tell me about a time when you disagreed with a provider's plan.
There was a patient that, let me see. There was a patient just a couple months ago on this rotation that I'm in now, who I thought we should maybe have considered intubating this patient. The provider disagreed. The patient was 100%, but he had a lot going on. The nurse was concerned, and there were, so, as soon as we had gotten there that morning, the nurse came and got us and said that they were concerned about this patient. He had the nurse had had this patient for a couple days and had just noticed that overnight his mental status had started to decline. He had been wearing a BiPAP throughout the night, and then during the day he was supposed to be on a nasal cannula. And the day prior he was much more arousable. He was actually like sitting up in bed eating some food. And overnight a lot of things happened. He became like a little hypothermic. They couldn't get a temperature on him. He was very like cool to touch, and it was much harder to arouse him. You had to kind of like sternal rub him, and then he would wake up and say his name. To me, he wasn't really protecting his airway. And I had mentioned, should we consider intubation? And we had just decided to kind of keep an eye on him. We had kept an eye on him all day, and his status really started to decline. He ended up getting intubated like right at 7 p.m. An hour prior, the nurse had discovered he had a blown pupil. We had to like rush him to CT, and then he got intubated as soon as we had returned to CT. I don't think, if we would have intubated him earlier, it wouldn't really have changed his course. But I just think that was a time when if I was the provider, I probably would have opted to intubate a little bit sooner. And then especially taking this patient off the floor to CT, it's like the last place you really want to have to intubate somebody. So
Sure. Okay. Did you bring up those concerns to your preceptor at all?
I did, yes. She was on the same page as me, but it was the attending, that kind of said, let's get him to CT first. And
Gotcha.
this particular, we round with like the entire trauma team, so everybody kind of puts their input in, and then the attending kind of gets the last.
Sure. What would your coworkers say if I called them and asked them about you?
I think that I have great relationships with all of my coworkers from the emergency department and now in the ICU. That's something that I actually take a lot of pride in as well. I kind of try and stay out of any of the like drama that goes on the floor, and I really try and focus on my work and why I'm there, and work as a team with everybody. I think the last thing anybody needs in this job is to go to work and not get along with coworkers and have those types of problems when you're taking care of sick patients. So I think they would agree that I'm a team player, that I try and be helpful, and that I am a good resource.
Yeah. All right. How would you decide if a patient needed to be intubated? I prepped this question before you really gave me your.
Sure. I think just going back to like ABCs, if the patient is not protecting their airway, their vital signs could be okay. Their pulse ox maybe 100%. But if they're not protecting their airway and they're at risk for aspiration, that would be a sign to intubate. And then certainly if they are are having decreasing sats, or they're not ventilating well themselves, that would be another indicator.
How would you say that you learn best? What's your most preferred learning style?
Definitely like hands-on learning for me. I can like read over something several times, but until I really like do it myself, and can like perform something in practice, that's what really solidifies it for me.
Mm-hmm. How do you handle criticism?
I like welcome criticism. I think my desire, especially in this career, is to really continue to learn and just like absorb any information that I can. And I think, one way to do that is by being open to criticism and like learning from feedback from other people.
Why should we choose you?
I am very excited about this position. I am reliable. I have a very solid work ethic, and if I were to get this position, I would really dedicate myself to this role in this program, and do my best. As I've done like in school, I would just put that same focus towards this role.
Mhm.
It's something that I'm really enthusiastic about. And
What shift do you prefer?
so with this particular role, I noticed on the posts online that some shifts are straight nights, and then there's some shifts that rotate. I'm open to either. Right now I do rotate from days to nights. And I think that's something that is feasible for me. So I'm open.
And how do you think you will handle the transition from working at the bedside to now being a provider?
I like being a bedside nurse. I have only been a bedside nurse for 7 years. I don't think I'm at that point of like burnout yet. So it is a little bit of like a lot, it's a little bit sad to leave the bedside right
Yeah.
now. But I am excited for this new role. I think, I'll learn to love this role as much as I love nursing. And I welcome this challenge, and I think it's exciting.
What is your greatest strength?
I would say my work ethic, honestly. Hard work was like instilled in me as a child by my parents. They both worked very hard their entire lives and are now happily retired. And I just think taking pride in your work, no matter what your job is really important. It's a character trait that I look for in other people that I surround myself with. And I just think it's important to want to do your best. I've worked really hard as a single parent, working full-time through school, raising my daughter. And it's something that, I want to pass along to her and show her that it's really important to take pride in what you do.
Sure. Tell me about a time when things did not go well.
Let's see. Okay, so I was doing a clinical with neurosurgery, neurocritical care. My preceptor kind of flips back and forth between both services. And this particular night, we were on neurosurgery, and we got a call for a consult in the emergency department. A patient had been emergently transferred from an outside hospital for intracranial hemorrhage, and was coming for a neurosurgery consult, and family was expecting like a surgical intervention. We had not had the chance to look at any imaging. We just grabbed a consult form and ran down there and did our assessment. There was some family in the room, and she had a decent exam. She still had all of her reflexes. She was responding to pain. She was on a little bit of sedation. She was intubated, and we had started talking to family about a hemicranie and what that would entail. And then we left the room and looked at her imaging, and it was awful. And because they had done a repeat CT here, I think it was because she had come from outside. We weren't able to look at anything yet. So they did a repeat head CT, and we then have to present the patient to the attending who's at home. So we call him at home, and the neurosurgeon, and he's like, it's a massive, devastating bleed, and there's nothing to be done. So then we had to kind of backtrack and go tell family, after we had given them like some hope that we could take her to the OR, that wasn't going to happen. And that was a good experience. I fortunately had got the opportunity to sit in on my preceptor on a couple occasions and kind of give that news to family. And, it's certainly devastating, but I think being able to see how she was just very good at it, very good at like presenting the information. And she would like circle back around an hour later and like would show them the scans. She's like, I always offer if they want to see the scans, because sometimes just seeing it themselves can really help them like grasp the severity.
Pictures worth 1,000 words. I always say that too.
Yeah.
Okay. Do you have any questions for us?
So when we had spoken on the phone, we talked a little bit about like the orientation being 6 months long, and I think all of my orientation questions were answered. I think my question is, other people that have succeeded in this role, what type of background did they have? And does my background compare in my experience?
Mm-hmm. Yeah, I think that's a great question.
Is it? Okay.
Yeah, that's a great question. Okay, what else would you ask?
So that's kind of what stumped me on the phone, because I had all these questions about the orientation, and before I could ask that, they had like answered all my questions.
Yes.
So I was like,
yeah,
because I've like watched all your YouTube videos, so I was like, I need to ask a question.
Yeah.
I was like struggling to come up with something.
Yeah. Did you do you have the downloaded PDF of questions to ask the interviewer? There's like 52 questions.
Oh no,
I'll send it to you. Let me
Okay.
do that. Okay, so all right, let's just go through this here.
Okay.
In regards to the questions you asked them, of course, that's my favorite part. So you definitely want to have, how long is your interview with a panel of people or one person? Yeah.
It's like 8 people.
Okay, and how long have they allocated for the interview?
I think an hour.
Okay. Is it just the one interview, or do you have follow-ups?
So the following day I have like a shadow.
Oh, okay, that's
like
great.
4 hours. Yeah.
Oh, that's great.
Yeah.
Okay. So what I would do then is 1 hour with a panel of 8 people. I would have at least 3 questions ready to go.
Okay.
And I wouldn't ask them, since you've got a shadow DOE, I wouldn't ask any so there are 2 categories, good for them and good for you. Good for you is how long is orientation? What's the schedule? Will I have to work holidays? How do y'all work together? Do you call the doctor to, those kind of things to help you determine if you're right for the role. But the ones that kind of continue to sell yourself is what I would say in this formal interview to do.
Okay.
The question you asked, what are traits of someone? Do I match with that? Can you tell me what's required of someone in this role? I really like, this is a emergency response team. So I would ask even very specific questions about that. Like, I know that this is a very kind of fluid role, and some days may be very busy and some days may
Yeah.
not be very busy. How do y'all fill in your workday when you're not very busy? Because while that's kind of a good for you type of question, it also shows them that you are already anticipating what the role involves
Mhm.
and what challenges are in that role specifically and how you will adapt to them. So I think that's a great type of question for this specific thing. You can also ask the converse of who does well, like, is there anybody who hasn't been a good fit for this team? And can you tell me why? Um, I always recommend that, what challenges does this department face? What will be my role in tackling them? That's always a good one if you have nothing else. But
Okay.
I'll send you that list. There's a whole bunch of them you can pick from.
Okay, thank you.
And you can kind of tailor them specifically for them. And then on your shadow day, you can ask all the other little nitty gritty things.
Okay,
Okay. So what I'm gonna do is go through each question.
okay,
Give you some feedback about them, and then kind of go through overall strategy, talk about your resume, and then any other questions you have, we'll get to. Okay.
okay.
Um,
Hey friends, are you a brand new NP, or perhaps you're an NP student doing an ICU rotation? Are you drowning in the vat of information overload and really struggling to assimilate new info? I got news for you. We have all been there, my friend. I get a lot of requests for educational content. I've started doing tutoring, and what I thought was I want to make this more accessible to all the people. And I know many of you are students and or new with your income, so money can be tight. So to combat that, I'm going to offer this membership site called the Acute Care Lab. I want to show you a little bit about it. Okay, so essentially this is a private membership, so it is a safe space for you to ask questions and get some education without feeling exposed to the public. This is going to be a bi-weekly live lecture format presented via Zoom. It will be an hour to an hour and a half long. You will have the opportunity to ask questions. It will have relevant information shared on a whiteboard with an associated PDF for each one. As you can see here, the first lecture is going to be on shock, which is the most commonest thing you're going to see in the ICU. So we're going to be giving a nice, long, in-depth lecture with live Q&A regarding shock. If you can't attend live, there will be a library of all recorded lectures available to you. And also included in your membership is a list of all of the archived PDFs that have been created for the course, as well as some extra stuff that I think could be beneficial to you. There's a private member forum that's for Q&A where you can submit any question at any point in time, and the group can respond, and I will respond ASAP. Last but certainly not least are going to be all of the exclusive offers that only members will have access to, which includes 25% off new products. And you'll also get free copies of the H&P cheat sheet and the companion after a certain time frame of membership. So I would love it if you would go check out my website at brianp.com to see if this is right for you.
So the first one, tell me about yourself. Your response was a little over 3 minutes, which is fine. You want it in that 1 to 3 minute mark. I thought it took you a little with all of the first couple of questions, it took you a minute to get the ball rolling. I think that you summarize, I like that you thank them for the opportunity. And then you segued into your personal life and your story as a mom.
Should I do that, or
I think that's fine. Some
yeah.
people do and some people don't. I think that's fine. It's whatever you're comfortable with sharing and whatever you feel like represents you. And I heard you say that several times in your interview, and I think that's great. That gives me an impression of who you are. It does also put in my mind just a little bit about, okay, well, what are her resources? Is she going to be able to flip shifts? That's why
That's kind of why I'm hesitant to even bring it up. But then I also want them to know, I've worked full time since she was born, and it's manageable.
Not the problem for you. Yeah, I think it's fine to say it. I probably wouldn't bring it up multiple times throughout the interview.
Okay.
Just say in the beginning, you talked about, you said you had 7 years as a nurse. You talked about your former career in digital art. You talked about nursing, but what I heard most of that response was nursing. What I wanted to hear more of was, a good response to this question is a summary of your professional career, just briefly, because they can look at your resume and see that you've had plenty of experience. So I would summarize it into a sentence. Thank you for this opportunity. I'm a single mom who has a very strong work ethic. I have been in nursing for 7 years with a background in ER and ICU and progressive. I think you said, yes, step down. Always been drawn to acute roles. And then I would segue the most of my response there into what it is that you want to do, what it is that you're good at, what sets you apart, what makes you ideal for this job. So you
Okay.
might say something like, 7 years experience in progressive care, ERICU, always been drawn to really acute roles. I love the buzz. I love the excitement. I like coming into a sick patient, trying to figure out what's wrong. And so I ultimately decided to go back to school because I'm fascinated by this mix of nursing and medicine and having one foot in each role.
Mhm.
Um, just kind of illustrating for them more about who you are as an NP, even though you're
Okay.
not an NP yet, so they can
Yeah.
see you
Okay.
as an NP. I mean, they want to know your nursing background. It is relevant for sure, but you just want to kind of balance a little bit of your presentation between, okay, here's how I have experience as a nurse. Here's a story of me as a nurse. I'm a nurse. I've been a nurse. I've had experience as a nurse. I'm not a fresh out the door new grad nurse. I have
Mhm.
experience at the bedside, but I also have experience as an NP, which you did as well. And we'll get to some of that and how to kind of balance, but
Okay.
definitely give them a full spectrum summary, who you are
Okay.
personally, who you are professionally, and who you are going to be professionally. Like just kind of follow through a little bit more.
Okay.
Um, and then why did you advance your practice? Just kind of added on to that. Your response was about a minute long. You seem to struggle. This is another one where you were like trying to think through like, okay, what do I want to say? How do I word it? I didn't have any doubts that you knew why you went to school, but I had a hard time
Oh,
seeing how you could verbalize why you went to school.
okay.
You said you were excited for the opportunity. You did mention that you like the nursing and medicine combination. I just wish you had kind of expanded a little bit more on that
Okay.
part. Because the problem is what we see a lot of when people interview right now is there are a lot of very green nurses going back to school because they just don't like bedside.
Right.
So
Right.
I want to make absolutely sure that's not you, that you're not
Mhm.
that person. And you did talk about that in other responses, but in this particular one, I hadn't quite gotten to that yet. So I'd love for you to talk more about what it is that drew you to being a provider, what it is that interests you about it.
Okay.
That kind of tells me, if I'm looking at hiring someone to do an emergency response kind of thing, what it is that makes you you and why you will be a good provider in that role. Um, yeah, so that was that one. And then I asked about your life flight rotation and I would, if they don't specifically ask you about this, I would bring it up in one of my stories because that is incredibly unique. I don't think I've ever seen anybody who's had a rotation in that. And if you're looking for someone who's going to be able to respond to emergencies with both ER and ICU experience, life
Mhm.
flight is it. Flight nursing is absolutely it. So make
Okay.
sure you're reminding them, hey, I've had this great experience where you have to make rapid decisions with not a lot of oversight. That's what an
Mhm.
emergency response person is going to be doing. So that is perfect. And you are probably the only candidate that will have that. So definitely make sure you talk about that.
Okay.
Oh, you talked about Metro's reputation, that it was a great program. I thought that was a great response. Oh, and then I asked you about procedures, which that was one of the questions I was going to ask you about later. So I just kind of bumped it in there. Mostly because when you're in these kind of roles, these kind of rotations, you do often get opportunities to do procedures. And because that's
Mhm.
mostly what you're going to be doing,
Yeah.
I'm not entirely sure with this program, given the information you gave me about this program, it sounds like they probably aren't going to care so much that you haven't done procedures because they're going to give them to you. They're going to give
Yeah.
you
They
plenty of
asked
opportunity
me
to
on
do
the
them.
phone already if I had gotten to do a lot of procedures. And I had mentioned like the ABGs, and then she was like, "What about ultrasound? Like, are you, do
Mhm,
you do ultrasound IVs?" And I was like, "Oh yeah, I
mhm.
do those all the time." So she's like, "Well, that's, you'll be working with ultrasound a lot, doing like lines and echoes and stuff."
Mhm.
But aside from that, yeah, I really
Don't
haven't.
have
I
any.
think on one of your videos you said to mention like that you have assisted and like some of those things.
Yes. Yeah, yeah. Observing them, don't take that lightly. Some of the
Yeah.
best proceduralists we've hired have been people who worked in ICU for a long time as nurses and who just really observed well. So they
Mhm.
knew how to set things up. They knew a lot of it is muscle memory, and it's do this first and do this first and do this first. And if you've watched it, that helps you way more than you
Yeah.
think. And I think that programs, particularly one as well designed in this as this and structured, they know that going into it, that if you've trained at level ones or academic institutions, you often don't get the opportunity because they give them to residents. That's
Yeah.
fine. I do not see that as a hindrance at all, and I doubt these people will either. But the question may come up, and maybe because they've already asked you, it won't come up again. But my response to it will be kind of like yours was. Unfortunately, I didn't get a lot of opportunities because of the, innate nature of how critical these patients were. People were hesitant to let a student try, or like my response was, because I was at an academic institution, procedures were favored by residents.
Mhm.
What I chose to do was focus on the medicine of it. I did observe a lot. I do understand the process of the procedures, and I have done some studying on ultrasound independently. But as I didn't have a lot of opportunity to do it, I focused more on the medicine, which to me is very, very complex and requires even more investment of time. And that's where I chose to spend the focus of my energy during my rotations, because I knew I wouldn't get a lot of procedures. I think that is a very grown-up response,
Yeah.
because that's the reality. And then I asked you about your rotations being at the same hospital. Do you think this will affect your training or experience? I thought your answer was really good.
Okay.
That I liked that you recognize that it might be a limitation, because when you're in one particular institution, the culture tends to be the same, and you'd be amazed at going from one place to another, how just a little bit of culture change can affect what type of evidence is used to practice. And so that sort of explains how at one institution, the standard is this, and at one, it's this. So you miss a little bit of that variety when you don't have the mix. However, you talked about how you had attempted and it didn't work out. And I would just, answer like you did, basically, that, I recognize this may be a limitation. I'm ready to learn new things. I'm always expanding my knowledge base, that kind of thing. What is your greatest weakness? You talked about imposter syndrome. Honestly, I would pick something else.
Yeah.
The
Okay.
reason is, I know I've talked about in a lot of my videos, you pick a problem that everyone goes through, and imposter syndrome is certainly a problem that everyone faces. So in some respects, I'm being a little bit hypocritical in saying this, but when you pick something that generic, it doesn't give me as much insight into how you're different, because
Okay.
everybody's going to kind of have that. I
Really?
want to
Okay.
be you, I want to know,
I'm nervous because like in this particular position, you are like the resource and, for other, their emergency response. So you have to have like a lot of confidence in this role. So I didn't want to say something, maybe that is a downside to saying like imposter syndrome or, like,
Well, what I really want from this question is, I want to know, are you the kind of person who is mature? Do you have emotional insight into what your struggles are? Because we all have them.
mm,
And then what have you done to, work around them? Which you did talk about. You did full follow through just on a problem
yeah.
that I wouldn't necessarily say. I mean, I would just get
Okay.
like, I would reflect, like, in all honesty, like, say it wasn't a formal interview, what would you say is your greatest weakness? For me, I have ADD, so it is definitely organization and focus. That is
Okay.
absolutely a problem for me.
Yeah.
Which, you kind of don't want to say, because you're like, oh my God, it's going to make me look really bad, right? It's going to make me look really bad. But the thing is, if you can admit to it, own it, and then show how you've developed coping mechanisms and how you deal with it, it shows me a very, very mature person. So I know that, if I were applying for an ICU job and I were hiring me, okay, I know I'm dealing with someone who may be a little flighty, but in hindsight, she has compensated for this by a lot of note writing and a lot of list taking and a lot of follow through, repeated rotations throughout the day in her unit to make sure she's done everything. And so I know that this person is not so egotistical that she can't admit what her flaws are and then grow from them, because we all
Okay.
have them.
Yeah.
Everybody's answer is going to look a little different, and you have to
Okay.
decide how vulnerable you really want to be with them.
Yeah.
But honestly, I find that the most vulnerable people are the ones I'm most likely to hire, because it shows me they're not hiding anything, and that I'm not going to get any surprises when they come in. So that's kind of how I would tackle that.
Okay.
Um, Tell me about a time when you disagreed with a provider's plan. Okay. I love that you picked. So I think all of your stories were from NP rotations, which I think is good. The good thing is that it helps me to see you as an NP. The bad thing about yours, unfortunately, is that most of your stories kind of illustrated how your preceptor, what your preceptor did. And
Okay,
unfortunately, that is some of the trade-off when you're telling an NP story. So
sure.
it's good to share an NP story, but you've got to bring it back to you,
Okay.
what you did, what you learned, how you grew. So like in this one, you talked about, and I think this is a perfect story. I would use this story because, and like I asked you later, into how do you decide if someone's intubated? You had already told me this story, so
Uh-huh.
you already knew instinctively that talking about how to make a decision about intubating is going to be important in this role. So I
Mhm.
think that's great. Very
Okay.
insightful of you to pick a story like that. What I would do in this story, let's see, you talked about, that you didn't feel like he was protecting his airway. Um, and then that I had to give you like leading questions, like what did you do about the disagreement? Um, in
Sure.
specific, when somebody asks you about a disagreement, they want to know what you did. So I'll come back to how I would do this story, but if someone asks you about a disagreement, make sure it's a disagreement you had, whether it's you and your preceptor or you and another nurse or you and a physician, what you directly did with that. They want to
Okay.
know how you're going to interact with other people. And in a position like this, so rapid response in particular, things they want to see from people like that are people who can assess quickly, have really strong assessment skills, and able to, assimilate that information into a quick plan of action. But you also have to be very democratic and work well with others
Mhm.
because you're often going into a position where you are not the attending team. You're going into a room of a patient that's probably owned by a hospitalist or a cardiologist. And they are sometimes there in the room and sometimes you're there before them, but ultimately it's their patient. So you
Mhm.
have to be able to make a diagnosis, hope and pray that it ends up being the same diagnosis as that attending,
Yeah.
because if it's not, then you got to figure out how to get them on board with you.
Mhm.
So definitely share some kind of story about, you and a nurse, you and a patient, you and a director, somebody where y'all butted heads or didn't agree, and how ultimately you work through things for the good of the patient. And sometimes it may be a situation like this where this physician felt like it was more important that the patient get a stats head CT. Um, this is something that will come up a lot, particularly when you're acting as an APP who's backed by an attending who's probably back in a unit though, but
Yeah.
you're going up with another physician and you are disagreeing with their plan. So you
Mhm.
have to be able to verbalize to them why your plan supersedes their plan.
Sure.
So say this had been a rapid situation with intubation, and the hospitalist felt like they needed a stat head CT first. You would say, well, Dr. So-and-so, in my assessment, the GCS is 6. I hear gurgling or stridor. He's not able to lift his head up. We don't have an ABG, and he's not particularly hypoxic, but he is apnea. He's agonal. His respiratory rate looks like it's only about 6 to me. My guess is that he's getting acidotic. I strongly suggest that we secure an airway and make sure this patient is safe for transport to CT. And so that's very objective information. It's a defined like third party perspective of what's happening and not just an opinion of you coming and saying, no, I think we should too, but he doesn't look so good.
Sure.
So
Yeah.
people respond better to that kind of information presented to them. And it's very hard for them to then go and say, no, we're going to do this first. So in summary, if someone asked me, trying to kind of commingle your story in this situation, if someone asked me and I was you, tell me about a time you disagreed, I would say, this one time I went in and this attending felt like this was not a good situation. As a student, I don't really have a lot of leg to stand on as far as how I can present a disagreement with the provider. But I anticipate that as a provider, should I go into a situation like this and it was a rapid response situation, here's how the objective information I would assess and how I would present it to the attending to suggest that the proper steps are this. So my way of dealing with this is just trying to step back and be as impartial as possible and take emotion out of the situation so that we can make a safe plan for the patient. That's kind of how I would answer that question if I was you.
Okay.
And that way it's sharing a story of how you're assessing an acute problem, which is what they need you to do, but also how you're handling difficult personalities or power plays, which you're going to find
Mhm.
yourself in a lot. So that's how I would handle that one.
Okay.
What would your coworkers tell me about you if I called you? I loved your answer on this. It was 1 minute and 12 seconds, which is a little short, but I thought it was a great answer. You smiled. It was one of the first time I had seen you smile, which is good. Make sure you're smiling.
Okay.
Um,
Okay.
it's the nerves, it's the nerves. And when you're nervous,
Yeah.
you forget to do it, but especially if you're doing things virtually, because
Yeah.
the eye contact isn't the same on a computer. So you gotta almost kind of exaggerate things a little bit, which feels awkward. So I don't know if have you done any other virtual interviews?
No, I
Okay.
haven't.
I'm going to you'll get a recording of this. So watch this recording when you come back and watch yourself, because you'll be surprised at, like, I honestly didn't feel like I was stressed, and I honestly didn't feel like I was unhappy, but I kind of look like I'm like majorly stressed. And it's just because you're not exaggerating your responses a little bit.
Sure.
I mean,
Okay.
obviously, at key points, but like, watch this one back. You'll see when you answer this question, you smile and you kind of chuckled a little bit. And I knew that I was going to get a genuine response from you because you felt a little more relaxed, at least the
Okay.
body language. The other thing while I'm thinking about it, for virtual interviews, make sure you have a lamp behind your computer or your phone or whatever it is so that I can see.
I was gonna do.
I mean,
I know the lighting's awful. I even thought about doing that.
It's really not bad. It's really not bad, but it could be better. So definitely put
Okay.
like a lamp in front of you so you're kind of highlighted a little
Yeah.
bit.
Okay.
Okay, anyways, you talked about, I loved your answer on this one. You talked about good relationships. And what's really, really great about this answer for this particular job is that that is key, right? They want clinical acumen, work fast, and work well with others. So the fact that you're telling me already that the people that already know you would say, she's a great coworker, there's not a lot of friction, she works well with others, she values relationships and communication, that's a perfect answer. So really good job on that one. How would you decide if a patient needed to be intubated? Oh, we already kind of talked about that. Yeah, use those objective words. So I heard you say a couple times, threatened airway or risk for airway, which is great. Go into a little bit more detail about those objective findings, the poor GCS, the, unable to control secretions, the, unable to lift his head, unable to verbalize, not breathing enough, whether it's agonal or, breathing too slow, low volumes, low chest rise, concerns that the patient is not breathing enough on top of an airway threat. Those are just they're just really objective. And it's something that I find that 9 out of 10 nurses who are training as new NPs don't recognize. So the fact that you're already recognizing that is great and just gives me a non-in-your-face way of saying, hey, I've been a nurse for 7 years in acute roles and I've looked at this, I've seen it a lot, I know what it looks like. So it's a great way of illustrating what you know without shoving it in my face. So really, really good response. Then how do you best learn? Hands-on, need to do it yourself. I could have used a little bit more. I think that was a great answer. I could have used a little bit more specifics on it. So definitely be thinking through, because this is such a well-structured program where they're going to give you in-depth training, a lot of hands-on experience. I think it's good. I love when I have NP students who can tell me exactly, this is how I learn best. This is what you can give me to help me perform better for you. Like an example of this, I had a student who told me that she learns best by verbalizing out loud what it is she's just heard, so that she can make sure that she has correctly heard the information, and that she's then, it's sort of like writing something down, it just solidifies it in your mind. And so
Right.
that's what she would do. She said, if it bothers you, let me know. But when we talk about something heavy, for me, I like to repeat it back to you to make sure I heard it correctly. And I thought that was brilliant because it helped me to know going into it what works well for her. Because as teachers, we really do value giving you what you need. It's just different for everybody. It's sort of like parenting. You'll find if you have a second kid, your next kid is going to be completely different than your 3-year-old. And you're like, well, wait, I've already figured out how to do this. How do I do it differently for this person? And it's challenging. So if that kid could tell you, Mom, I like to challenge the status quo, and you're going to need to set hard boundaries for me. Wow. Okay. That would just make you just skip all the hard steps of parenting, So same thing as a person who's learning, your program is so, so great that you're interviewing for. They're going to give you exactly what you need. So if you can tell them what you need, you're steps ahead. And it also shows me that you've done a lot of self-reflection on who you are as a person, who you are as a learner, and that you're already thinking through, okay, I know I'm going to have some imposter syndrome. I know I'm going to have some learning curves, and here's what I can do and how they can help me to get past all that because I want to be a good provider. So also a very indirect way of showing them that you value strong clinical skills. How do you handle criticism? So I asked you this because, again, with a program structured like this, I have a feeling you'll get a lot of feedback from people, and that's good. But sometimes, you want to know when you're hiring someone, is this the person who's going to be able to stand up to or be able to handle some strong personalities? Because physicians can often not be gentle in how they deliver it. And you talked about welcoming it. I think that's great. I think I was asked this in one of mine, and I said something along the lines of, I am probably my strongest critic because I have high expectations in myself and I have a strong desire to provide clinical excellence. So there's not a lot that can be said to me that I haven't already said to myself. Having said that, I struggle with it a lot. And there are a couple of days there where I'm going to have sleepless nights because I'm going to worry that I've been doing a bad job or that I made a mistake and it's going to bother me. But ultimately, it inspires me to learn more, grow more, do more. And then I'm going to obsessively study whatever this thing was that I feel like I didn't do a good job with over the next week. And then I will feel stronger going forward. So ultimately, I see feedback as a way of helping me to level up and to be a better provider, but it is hard for me. And I think that's also a good, like, vulnerable way of showing them that you, again, have insight into yourself, but it's important to you, which I heard you say in several different responses you gave, that you desire clinical excellence, which is great. Yes. That's great. Why should we hire you? You're excited for the job. You're reliable. You have good work ethic, and you're dedicated. It was a 50-second answer. I thought was perfect. That was a perfect answer. What you could also say on this one is, definitely showing your passion for the role, but, I'm the perfect person for this job. I have the exact background that you need for this role. I spent so many years in the ER. I'm able to quickly walk into a situation of an unknown problem and perform good assessment skills in order to get to a proper diagnosis. And I followed that up with X years in the ICU, and I know what sick looks like. So I know when a patient needs to be moved to the ICU and when things need to happen quickly and when things don't need to happen quickly. On top of that, I did a rotation with the Life Flight team, and I got to see in action very acute situations with minimal oversight. So I am really good, and I have seen people do this well and have a plan, to deal with this kind of unique role. That's what makes you unique. So that will sell you. And I feel like that kind of an answer would probably get you a job, because you are so different than everybody else. That's why I said, this is your job to lose, truly. I mean, I don't know what the competition looks like up there, but there's not a lot of people who are going to have the exact set of experiences that you have.
Yeah. I'm sure this is, I'm sure there's a lot of applicants, but I know in my program, I think I am the only person with emergency department background.
Yes.
Yeah. And I know of one other person in my class that's applying, but there are multiple spots. So
I'm telling you, it really, from everybody that I've met doing this and then in real life, very, very few people have both ER and ICU. And nobody has ever done a flight nurse rotation. So
Well, that's good
It
to
makes you
know.
very, very valuable. We asked about how you'd handle the transition. You said, I liked your answer that you said that you were transitioning not because you were burnt out, so you still have connection to nurses.
Yeah.
And that you welcome the challenge. I think that's great. I think too, because of this unique job where you're going to be put into a situation where you're going to go into a room with probably a lot of nurses in the room, having that rapport and the ability to communicate with them in a way that doesn't come across condescending, so that they don't give you pushback. Okay, here's a new grad NP who thinks she knows everything. What am I going to do? But being able to verbalize this objective information. I think this patient needs to be intubated, and here's why.
Sure.
So dealing with some of the relations in regards to working with other nurses or working with physicians more closely, that's kind of what they want to hear about, how you're going to handle that kind of thing. Tell me about a time things did not go well. You talked about the neurocritical care. That was another one where I thought it was a good story, but again, I was getting a better impression of your preceptor than I was you.
Yeah.
Yeah.
Okay.
Yeah. And then what is your greatest strength? You talked about your work ethic, which I think is great. I could see from the responses that you gave me that you have good background, which I see on paper, and you followed it up in your interview with responses that made me think you hold a high standard for yourself. So you're going to be a lifelong learner. You're going to be the kind of person who wants to understand why over how in doing things, which makes you very, very intelligent and have a really strong sense of clinical acumen, which is key in somebody going into this kind of a role. So I thought that your responses were overall very good.
Okay.
So that is all of the feedback I have on your questions.
Okay.
What questions do you have for me?
So you've done a lot of interviewing. I think I saw on one of your videos that like you interview candidates for your department.
Yes.
Is that right?
A lot.
Do you think they're gonna what is the likelihood that they're gonna have like a case study or clinical questions? And
yeah, that's a great question. So I personally have maybe one time in 7 years have I ever asked a question, one or two times maybe. Typically speaking, people are only going to ask clinical questions if they want to verify what your background is. If I feel like, I want to know, I'm not getting a good sense from this person from what they're saying or what's in their resume, that they actually have the experience that they say they do. It's going to be a question to your level. They're never going to ask you something that they wouldn't expect you to already know. It's not going to be something that an experienced NP would know, because they know you're in an experienced NP, but you are an experienced ER and ICU RN. So it could be something along the lines of, your patient has a blood pressure that is dropping acutely and your heart rate is going up, and that they just had surgery, and you call the provider and you let them know that you have an issue, you're concerned about shock. They give you an answer like, okay, let's give them half a liter of LR. In your mind, what is your next step? That would be a question I would ask, because I would be thinking that you as the nurse would already be thinking, well, this patient may be bleeding. I'm concerned with bleeding risk. They just had surgery. They're tachycardic. They're hypertensive. My concern is, are they looking through and thinking through what could be the causes of the shock? In particular, because this is something that happens a lot in reality, mostly with more floor patients, because you call hospitals and like, just give fluids, just give fluids, just give fluids. Nurses know, because they tell me already, like, I don't know that this person needs fluids anymore. Like, they already know. So it would be something along those lines to verify that, okay, she's worked as an ICU. She truly has worked as an ICU nurse before. So it's not common that I ask that. Now, I do know that some fellowship programs tend to ask this kind of stuff. for that reason. They want to make sure
Uh-huh.
that the person they're bringing in for a fellowship has experience as an RN, and they can build on that. So it's not common, but I wouldn't like be worried about having to study for anything. Okay. If they ask you a clinical question, it's going to be something that you can draw on your experience to answer it.
Sure. Okay. Okay. And then, so with this, like you encouraged me to bring up this Lifelike clinical, and I was a little hesitant because there are, maybe not to bring it up, but so Cleveland Clinic has a Lifelike program and Metro does, and they're kind of like compete, like they kind of, I don't know.
Yeah.
And a lot of people from this program that I'm applying for, a lot of like former house officers have left this role to go to Metro and go on their Lifelike team. So I didn't know if like bringing that up would cause them to be like, is she just trying to use this role as a stepping stone to
I see.
like be a flight nurse?
A common question, I didn't ask it of you, but a common question that people will ask is, where do you see yourself in 3 to 5 years? That would be your your time to say, you know what, this is the perfect job for me. This is where I see myself. This is, in 5 years, I see myself as a competent and confident provider in this role, potentially teaching new NPs, and, advancing within this program, should there be an opportunity, but something that tells them that you're committed, you're going to stay here, you and your daughter live here, this is your community, this is the hospital you want to work for. The way you could put that is maybe in the if they ask you that, why should we hire you, or I think, what other questions did I ask you that you could weave that in a lot of different places. Or if they don't, at the very end, you could say that when you opened with thanking for the opportunity, you might end that way. You might end by saying, thank you so much for bringing me in. I appreciate the opportunity. I really think I would be a good fit for this job, and I really want this job. This is where I see myself in 5 years.
Okay.
I'm very committed to your team is amazing. I would love to work for you. Things along those lines to show them that they are who you want. And if you're concerned and specific about the flight nursing thing, you might could just leave, don't focus so much on the Metro aspect of it. Just talk about the experience of it, the opportunity to see such acute situations without a lot of oversight, and how do you handle that kind of a thing. So that might help lighten some of that, like, tension type of thing.
Sure.
I would hire you.
I just hope my nerves will get to me.
Yeah. You'd be amazed what I hear from people. Obviously, I'm not with people in their actual interviews, but what I hear from people is that they feel a lot better after they've done this one, because it sort of gets the nerves out. Because even though you kind of know me, you kind of don't know me, so there's a little bit of pressure there. So you've kind of sort of already done it once. So the next time you're just like, you're tired, you're already like stressed, and you're just like, okay, I've already done this once, it'll be fine. And it goes a little easier.
No, I'm happy I did this. I think it'll be.
But I think overall, you did really, really well. You did very, very well. You come across as a very genuine person. I would absolutely hire you. You have no like personality red flags that I saw at all. I think your interview could be tweaked and tightened up in places, but overall, I thought you interviewed very, very well. And you've got the right experience for this job. So I will be shocked if they don't offer it to you. You're absolutely welcome. I will send that over to you, and I cannot wait to hear how it goes.
Okay, I'll let you know. All right.
All right.
Thank you so much.
You're welcome.
Have a good day.
You too.